labor and delivery Q&A. I'm so excited to film this. You have no idea. I put on my pajamas that I wore after I had Wesson to like channel my inner thoughts from back in the day. My son is now 6 weeks old, so I'm gonna go ahead and just get started. If you are new to my channel, please subscribe. I am sharing just my life with you guys and my family and everything. So first, how long did you push for? Oh, really quick, something I want to state before I really get started is I'm just sharing my experience, my thoughts, and everything that happened to me. Don't use this as like a comparison or even a standard or an expectation. Don't have any expectations. Everyone's labor is different, everyone's child is different, everyone's pregnancy is different. So I think it's good to share and be open and talk, and vulnerability has helped me so much, and it's also helped other moms out there from my channel, I have come to find out. So that's why I'm sharing like my truth and just speaking about my situation and sharing. But by no means is this what you're gonna experience, and it doesn't make mine better or mine worse. Everyone is on their own path. So I'm gonna put up this little picture thing that I saw and screenshot it, whatever. It is so true. Absolutely. How long did I push for? I pushed for about 5 to 10 minutes. Pretty quick, especially for a first-time mom. Were you planning on not receiving an epidural, or was your labor just too quick to get one? I did not have an epidural, and I was planning on not having an epidural. So all along, I did not want to have an epidural, and I was able to achieve that. And that literally makes my heart so happy, because that's something I've always wanted from before I was even pregnant. And I have nothing against epidurals at all, not one bit. It doesn't make me any more of a mom or any more of a superhero or an award or whatever for going without an epidural. And I have, like, it's no medical reasons or anything. It's just I wanted to see if my body could do it, and my body could do it because our bodies are made to labor. Okay, so some poop questions. Did you poop? That's my fear, LOL. No, I didn't poop, but something I want to talk on that is don't let it be a fear of yours, because first of all, if you poop or if you don't poop, you're probably not going to know unless you specifically ask, and even then so, the nurses might not tell you the full true answer, because there's no shame in pooping or not pooping, none at all. Nurses aren't like, nurses are it probably happens so often that they're not even gonna be like, what's the word, like phased by it. Like they don't care, they'll just clean it up, whatever. Like I'm sure it happens so frequently. In your moment, you're pushing your child out. That hurts, and that's exciting. So you're not thinking about pooping, and most likely you're not gonna care if you do either, because it's the most vulnerable state a woman will be in, and just who cares, honestly. But I didn't poop. And I know that because I asked, and I knew some of the nurses, and Grant was there, my best friend was there, and I asked them and they said that I didn't. I didn't care. Like even before going into labor, I didn't care if I was going to poop or not. I actually thought I was going to, but I didn't care. And actually, as I was pushing, I was in between these insane contractions, and I thought I had pooped, because when Wesson's head was like coming out, like it didn't shoot out all at once. It was just like a few pushes, and it would kind of like come out and go back and come out and go back in, and that happened like must have been like 3 times or something. And every time his head kind of went out, I thought it was like a little poop turd coming out, poop turd coming out, poop turd coming out. And I was talking to the nurses holding my legs, and I was like, I just pooped, I know I did. Like I was speaking to them like, tell me I pooped, I know I pooped. And yeah, that's pretty funny. Like as I was pushing, I was caring and thinking about pooping. So I guess I just told you you're not going to be caring about it, and then I actually was talking about it in the moment. So whatever. I don't know. I didn't poop, and that's what you guys asked, so that's what I'm answering. What was one thing that happened to you that you weren't expecting? Something that happened to me that I was not expecting. So I got induced, so when Pitocin hit, I thought contractions were going to amplify like crazy, and I felt absolutely nothing. So that I was not expecting. The pain after my labor, I was not expecting, which I'll touch on that in this video more in depth. And then also, is there anything else I wasn't expecting? Grant was so incredible. My husband through it all, and I knew he'd be good, but I honestly didn't expect him to be that good. And then after baby was placed on my chest, that I'll also talk about later in this video, that whole situation I was not expecting. What was the hardest part about labor? Definitely the hardest part was right before pushing. Oh my gosh, that pain was something else. I can't even explain the kind of pain that I was in. So right before pushing my baby out, I would say it was worse than pushing him out, or maybe they're exactly the same. That time frame was a B word, shall we say. Okay, I got a few questions about tearing. I got a 2nd degree tear, not too big of one, and it didn't hurt because it happened when my baby's coming out. So of course, like, I was just in a ton of pain from a baby coming out of me, but I couldn't like feel my body tearing. So I would say me tearing did not hurt because I'm focused on my baby coming out of me, and that pain freaking hurt. So that pain overtakes the tear. You don't even know you tore until the doctor tells you. When Weston was coming out of me, he had his right arm up. The doctor said it was like he came out with a right hook. So he had his fist up by his face, which was so cute because after in his newborn stage, he always had his hands up by his face, and especially that right hand. But that was up by his head when he came out. So it wasn't like just the circumference of his head, it was also that right hand up there, and his elbow is actually what the doctor said like got me and like tore me a bit. So I did have that tear, and it didn't hurt when it was happening, but girl, the afterwards pain hurt so bad, and I think it was because I tore. Yeah. Does it hurt when they stitch you up? I did get stitched up. I do have stitches, obviously, or did have stitches, because if you tear, you get stitches. But did it hurt? No, it didn't hurt at all. And that's something, I did not have an epidural, and then so afterwards I wasn't numbed down there. But they give you like, I think a shot of like something. She told me like it was gonna feel like a bee sting or something, but Weston was already out on my chest, so I didn't feel a single thing from that. I think I actually have a vlog clip of that in his birth vlog, and you can hear at the end like the doctor telling me like, okay, I'm gonna stitch you up. That audio's in the vlog, so you can look at that. What happens in the room after you have the baby? How long are doctors in there for? Another good question. Actually, after I had him, I blacked out. So yeah, that's interesting. And the doctor was probably in there for maybe 15 minutes, just enough to really stitch me up, and then she was on her way. I didn't even know when she exited because they just let you have that moment between you and your baby. And then the nurses, there's a few more nurses than normal that are in there with helping with the baby and holding your legs and stuff, and they left like right away, I'm sure. And then my nurse that was like my delivery nurse that always came in and checked on me during that time, she was back there maybe a little bit longer, maybe charting and stuff. I don't really know. It's so, once again, just after that moment your mindset's not on that, but they're definitely not in there like a crazy amount of time, and they're not rushing around or talking to you and all that time or that stuff. They really let you get that time in with your baby. And I did 2 hours skin to skin, and skin to skin was important for me, but I thought it was just an hour that I wanted. But the nurses told me that they suggest 2 hours. That's actually what they wanted me to do, was 2 hours skin to skin, and they wanted Weston to latch and get a feeding in before that time was up. So yes, that's kind of immediately following delivery. Actually, immediately following, they do the placenta, stitch you up, and he's on your chest and stuff, as long as your baby's healthy, obviously. Now this question, what was your first thoughts when you saw Weston for the first time? So this kind of is like sad. It's a sad question for me, I would say. What I was number one most excited for during the hospital was that moment that my baby was placed on my chest. I thought it was going to be like heaven here on earth, and like, like angels. Like, I just thought it was going to be like the most beautiful moment ever. I've heard a lot of women say that, and so I just expected that for myself. It wasn't that way. Not at all. I was so out of it. I'm sure it was like, I don't know. I was just so out of it. I think it was probably more beautiful for Grant, but my labor in particular just progressed so quickly at the end. I was just mind blown. When he came onto my chest, I was just mind blown at what my body had just done, how fast it went, and that he was already here. Like, literally minutes before him coming out, like 10, 15, 20 minutes before him coming out, or less than that, I thought that I was like nowhere near even the pushing stage. I thought I had hours of delivery left. I thought I would probably have my baby the following day. And then all of a sudden he's here breathing on my chest. So I was like, what the F just happened? Like, so surreal in that aspect. So I didn't have that like, ah thing. And so my advice to you ladies would be, and I'll actually answer it, it's the last question that I'm going to answer about like expectations. But right now I'll give you a little preview, is just try not to have expectations going into your labor and delivery, especially, but also with your pregnancy and your baby. Just expectations aren't the best to have, because anything can happen in your labor and delivery. And like, for example, I was so looking forward to that moment, and since I didn't have that moment, it's kind of a touchy question, and like kind of makes me kind of sad, because it then makes me think in my brain, I'm not this incredible mom that had this immediate immense love and connection with their son immediately when they were placed on their chest, and it was like, ah, and like this amazing beautiful thing. And that's what I had always thought and was excited for. And since I didn't have that, it kind of is like, oh, well, am I not the best mom? Or is the love not as good as the love other women have for their babies? I think you hear about that kind of love so much, and it just wasn't my experience. So that's just some honesty right there for you guys. And now next I got some questions about mucus plug. My mucus plug came out early. It came out at 33 weeks. That's not super normal. If you're not pregnant or you don't know what a mucus plug is, first of all, you probably are thinking, oh, that word sounds gross. It's something that comes out of you. I'm no doctor, okay? No doctor here. But it's something that comes out of you, typically I think like right before you go into labor, or a few days before you go into labor, and sometimes it can come out earlier, which is what happened to me. So it came out at 33 weeks, and I called my doctor that night, like the on-call doctor, and asked them what was going on. They said that they're pretty sure that that is my mucus plug. And then 2 days later I called them again when I was at work, because more was coming out, and I had like period like kind of cramps happening with it. So they wanted me to go in and see them because it could have been a sign of early labor. And I was so nervous because that was 33 weeks. Like, that's way too early for your baby to come. But they did verify that it was my mucus plug coming out. And my mucus plug came out from 33 weeks on to 39 weeks, basically 40 when I had him. And mucus plug is something that can regenerate itself. So that's what happened to me. Some people have like some blood in it, and it can be different for everyone. My mucus plug looked like just snot. It just looked like literally snot on a toilet paper, and that's what mine was. It came out at 33 weeks. It did not hurt, and I didn't really feel it. It just felt like maybe discharge coming out. Now, if you're watching this video, I'm going to be honest. I'm going to be upfront. I'm going to give you the facts. I'm going to tell you different things that happened, if it's gross, whatnot. So if you're not interested in that, then don't watch. Did you ever have any scares before your due date? Yes, I had like 3 different scares before my due date, thinking that it might happen. That mucus plug at 33 weeks, and then a few, like 2 other things. I didn't feel much movement at all, and they always tell you in appointments, like, if there's any decreased fetal movement, like call, like let us know, like that's a huge thing. That happened, the mucus plug thing, and then I think I had maybe some blood or something. There was something else that happened, I can't even quite remember. And I actually filmed that, like me calling the doctor. I vlogged like some clips of those parts. So I have that, and I was going to put it up at the end of my pregnancy, and then I ended up having him too soon, and I still was going to post it after I had him. I was going to make it like weeks before labor and delivery or something like that, like what the few weeks before looked like, because when I was pregnant, that time you're just so, I was the most anxious I had ever been in my life, and I'm not an anxious person, but it's like every day, every night for 4 weeks, like a month or something, not knowing when this life-changing event is going to happen. So every little thing that happens, you're kind of on the edges of your seat and asking questions and whatnot. So I always would search onto Google or YouTube trying to figure out like what those days, weeks, whatever leading up are like. So would you guys be interested in seeing those things? Because I do have actual vlog clips in the actual moment of that mucus plug coming out, of calling the doctors, of like going to the doctor's office, of crying because I think my baby's coming too soon and it's not healthy. Would you be interested in seeing that? Or is it, I'm 6 weeks out, is it like kind of too far out? Was there a certain smell during the labor? I thought that was a really interesting question. Once again, I'm like in pain, you're in pain, you're pushing your baby out, whatever, so I don't think you're really focused on a scent. But I did ask Grant that question, and he said no, that there was no certain smell. Was there anything besides Weston's heart rate that scared you? Weston's heart rate dropping right before he came out, that didn't scare me because I didn't even knew it happened. Like, I had no idea. I didn't know about that until after I had him, of why they were putting the oxygen mask on me. I knew there's an oxygen mask on me that they were making me breathe into, but I didn't know why. I do know, I guess, that like an oxygen mask maybe isn't the best because it's meaning like your breathing's not sufficient enough, but I was so out of it, I had no idea. So I wasn't scared about that. But also something is, I had complete trust in my nurses and my doctors. I knew they were going to do the best for me, and I knew they were going to do the best for my baby. After I had him, I blacked out. I thought I might have been hemorrhaging, and that kind of is like a scary thought, but my mind didn't go to fear in that moment. My mind went to be in focus and do whatever the nurses and doctors tell you. So once again, my mind went into, I trust my nurses and doctors. So maybe that's like that's one thing that could have scared me, but more so my mind was just, okay, let's focus and trust them. Speaking of, I never really went into depth about that. I'm just talking so much. I'm sorry. I need water. Really had to pee after I had him. Now, I did the 2-hour skin to skin, and then after that was up, he went over to Grant, and Grant started doing skin to skin. Right after those 2 hours, I had to pee. Now, my nurse really wanted me to eat first, but I had to pee or else I was going to freaking pee myself in the bed right then and there. And so I told her I really had to pee, and she said, well, 1 second, I need two people need to walk you to the bathroom. And I was like, I can't really wait that long, like I really have to pee. So she asked me if I felt dizzy, and I said, no, I don't feel dizzy at all. I didn't understand why she was asking me that, and they asked me so many times, and I was so confused why they were asking me, because from where I was to the bathroom, it was just a few steps. It was so close. If you're in the medical field, or if you're ever a patient in the hospital, you might know why they were asking you, literally for blacking out purposes, which is what happened to me. But I've never been a patient, so I had no idea why they kept asking. But I laid down, and then when I sat up, they asked, do you feel dizzy? I said no. I turned to the bed. Do you feel dizzy? I said no. I stood up. Do you feel dizzy? I said no. And then they kept walking, and they said, at any time if you feel dizzy, like, let us know. Before, they had like a gate belt on me, and then 2 people on either side of me. This was 2 hours after I had my baby. So I go, and before I'm getting ready to sit down on the toilet, they have me standing there. Do you feel dizzy? Like, they kept asking. I said no. Sat me down. And then I felt this weird feeling. What it felt to me was something I experienced actually for the very first time in my life at the first trimester of my pregnancy. Immediately, like, I got a hot flash, like crazy, super hot, and just a spacey feeling, like shaky, spacey feeling. And I kind of felt that come on, and I thought, it's not that bad. It's not as bad as it was when I was pregnant, so I'm not going to say anything because it's going to be fine. I'm someone that just wants to like be tough, and just my body can do it. So I almost didn't say anything to my nurse, but then I thought, she told me if I'm feeling dizzy to tell her, and I didn't quite know what dizzy meant, but I was feeling kind of spacey. So I told my nurse, I was like, I'm kind of feeling this way. I don't know if it means anything, but I just thought I would tell you. Like, I told her basically those exact words, like nonchalantly. And she said, okay, thank you for telling me that. Like, keep talking to me. Like, keep telling me what you're feeling. At that point, I probably was super pale now looking back on it, because when that happened to me when I was pregnant, my lips went the same color as my face, and I got really pale all over, and I was even sweating. And I never blacked out then. And in this moment, I blacked out. So that's exactly what happened. I blacked out. I woke up to hearing my name, Alyssa, 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 and I had fell into the nurse tech, like the technician. I fell into her body and she like caught me basically. And they just kept saying my name. They said, look us in the eyes, look us in the eyes, talk to us, talk to us. What is your husband's name? And I said, Grant. And they said, what's your son's name? And I was like, Wesson, Grant, 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 Grant. I just kept stuttering over Grant. And so they called on their like little call thing out for the head charge nurse to come in. And I used to work at the hospital, so I knew the charge nurse was the charge nurse. And I knew that's not, the charge nurse doesn't always typically need to come in to labor and deliver, or after, like that's not normal. And I knew that in the back of my head, so I knew something good, not good, was happening. And they had a sense of like urgency for me, not stress. Once again, I really trusted them, which I'm so thankful for. But I knew they had a sense of urgency, and I could just feel that. I was so out of it, but I could feel that in them. And I thought, once again, like maybe I was hemorrhaging. So I told myself, Alyssa, whatever, something not right is happening, you have to listen to them immediately. So when they said, look me in their eyes, I was probably like Hawkeyes, like staring them in the eyes. And when they told me to do anything, I did it because I was like, I need to do what they say. So then a bunch of these nurses all came back, and it was so cool to look back on, and something that I really liked taking away from my story, because all the nurses knew exactly what to do. They knew exactly how to perform, and it was like boom, boom, boom. It was so fast, but they all were performing a different task so beautifully all together. So I just have a lot of respect for that. But the one nurse like pulled out this thing, and I thought it was something I needed to eat. So I'm trying to do whatever nurses say. So I'm like a freaking shark trying to eat this thing. They're like, oh no! And they pull it back, and it was like a thing I needed to smell, like breathe into. Help my mind get to the right state. So they said, breathe in. And I was like I took the biggest breath ever. That stuff was strong. I was like, whew. And then they said, breathe again. And I breathed it in again. And it was kind of helping me. And at that time, they kept saying, look at us, like keep talking to us, keep talking to us. So I'm like, hi, mine, like I am, whatever. Like I was just making up random sentences. And then the one nurse, the charge nurse, she said, hug me. And I didn't know why she was telling me to hug her, but I was like, I gripped onto her for dear life. She told me to hug her, so I'm hugging her. And then they had me sit down on this like little wheelie thing. And then they wheeled me out to the bed, but the whole time they were like, look up, look up, look up, like keep staring at the ceiling, look up, look up. So the whole time I'm like staring up or whatever. And they're like, stay with us, stay with us. And then she said, hug me again. So I bear hug her again. And then she picked me up and let me get to the bed. But they all just performed amazing. And then I was fine. I got water in me. They got fluids in me. It did happen like a few other times where I was like uncontrollably shaking. They checked my levels and everything, and I was fine. I think at that point, the reasoning for it, I think, was just that I needed water or something. I kind of forget, but they all performed beautifully. I have like so much spit in my mouth. Okay, that is the video for you guys. I hope you enjoyed it. I'm gonna do a postpartum Q&A for you because I have too many questions here, and obviously this video is hella long, so that video will be coming out soon. And I hope you guys enjoyed this. I hope you enjoyed the honesty. Please subscribe to my channel, please. It would mean the world to me. Share with your friends. That's the biggest compliment ever. And you can follow me on Instagram, and I now have TikTok. Yeah, thanks for watching. But if I mean to show